Welcome to the eVentilator web application. I will go over the main features and walk through enrolling a new patient and generating some ventilator recommendations. This is the home page. Throughout the app, you'll find these helper icons that give you some instructions about what you can do on a given page. Just hover over or tap the icon to see the instructions. We also have a link to the terms and conditions. And then next, there's a choice to either select an existing study, enroll a new patient, or watch the tutorial video. Let's start by enrolling a new patient. First, select if you'll be using years or months to enter your age. A random ID is then assigned for our patient. Enter the age, first initial, last initial, specify gender, and height and weight. On the right, we display predicted body weight, and the admin settings contains information that will change how the application functions for a particular patient. We can select to use high ARDSNet PEEP FiO2 tables instead of low. We can allow rules between inhaled nitric oxide. We can also put a restriction on how high the ventilator rate will go by enabling the obstructive airways adjustment. Click Submit after configuring the patient. Here we'll begin by entering our blood gas information. We specify the ventilator mode, volume control, PRVC, pressure control, or high frequency. Choose a breath type, assist control, or SIMV. And next we'll choose the blood gas type, arterial, capillary, or central venous. We don't have the option right now to evaluate without a blood gas because it's our first assessment, so let's start by entering an arterial blood gas. We'll enter in the pH, CO2, bicarbonate, PaO2, and end-tidal CO2. Here we'll enter in vital sign and ventilator information. It begins by asking if we're triggering the ventilator. If they say yes, we ask more questions. If they say no, then a lot of these questions about spontaneous rate and effort go away. Let's say that they are triggering the ventilator, and then they'll ask about respiratory effort. Is it minimal, acceptable, or excessive? We have some descriptions for what would kind of meet criteria for this, and question mark boxes that if you click on them will show a picture about what some of these terms mean. They can be closed, and we'll enter in information. So let's say total respiratory rate, the set ventilator rate, peak inspiratory pressure, the PEEP, FiO2, SpO2, mean airway pressure, set tidal volume, in this case we're in volume control, the plateau pressure, inspiratory time, and also we have to acknowledge that we've agreed to the terms and conditions before we can generate a recommendation. Okay, we'll click Submit. This is our ventilator recommendation page. We have a separate recommendation for both oxygenation and ventilation. Oxygenation controls PEEP and FiO2. Ventilation controls set tidal volume, set ventilator rate, and set delta P. These recommendations can either be accepted or declined. If you decline, we ask that you specify the reason why you declined. The underlying rules can be viewed by going under Recommendation Tables and clicking Show. We have the recommendation tables for both oxygenation and ventilation. After viewing the tables and agreeing with your recommendations, you can click Submit to go to the dashboard. The dashboard contains demographic information at the top, as well as the current phase that they're in, whether acute or the weaning phase. We have alert information specifying the severity of ARDS. We also have a timer that will tick down to say when they're due for their next assessment. We have a series of graphs that they can view also. That needs to be changed to whatever kind of physiologic parameter that you're interested in. You can also view previous assessments. So we can click on any one of these past assessments and we can find the blood gas information they put in, the measurements they entered, and whether they accepted or rejected the recommendation. Last, we also have a pH nomogram that will show if they have acute or chronic acidosis. There are 3 action buttons. We can either view the study list, which will take us back to select a previously existing patient. we can click Take Measurements, and this will run us back through that whole assessment sequence where we enter a blood gas and generate a ventilator recommendation. This time, though, if we did enter in an end-tidal CO2 with a arterial venous CO2, we can evaluate without a blood gas. We also have Assess for Spontaneous Breathing Trial. So let's click that. This page contains information about criteria for conducting an oxygenation test in a spontaneous breathing trial. If they meet all those criteria specified below, then click Yes. Otherwise, click No. After meeting our initial criteria, you'll then be asked whether the PEEP is set to less than 6 centimeters of water pressure. If it is, then we don't need to do the oxygenation test. They already passed. If no, it'll walk us through the oxygenation test. So let's click No. This is the instruction to how to perform the oxygenation test. It asks us to set the PEEP to 5 and the FiO2 to 0.5 and click Start when we're ready. We're then asked to monitor the patient for at least 30 minutes. If the SpO2 remains above 89% with an FiO2 less than or equal to 0.5, then they pass, and then we'll click Yes. Otherwise, we'll click No and go back to the dashboard. So let's click Yes. After passing the oxygenation test, we're then asked to begin the spontaneous breathing trial. Otherwise, we'll say that they're not eligible for an SBT at this time. So let's click Begin Spontaneous Breathing Trial. Here we're given instructions to first take vital sign and ventilator information prior to placing them on CPAP of 5 with no added pressure support. So we'll enter in their respiratory effort, their set pressure support, total respiratory rate, heart rate, PEEP, FiO2, pulse oximetry, mean air pressure, tidal volume, and end-tidal CO2. And then we'll submit. We are then given instructions to place them on CPAP. We have failure criteria to monitor and a timer that ticks down from 2 hours. After finishing the trial, or if any of these failure criteria develops, we'll click End SBT. Before ending the spontaneous breathing trial, we ask that you take measurements one last time. So let's say they failed the spontaneous breathing trial, they had excessive respiratory effort, they had a very high respiratory rate, heart rate increased a lot, FiO2 needs went above 0.5, and tidal volume and end-tidal CO2 increase. We're then given the extubation recommendation. In this case, it's recommending not to extubate, and it tells us why. It presents all the failure criteria. And so now we can choose that we will not extubate, or that we still wish to extubate anyways. So let's say we will not extubate. We've now entered the weaning phase. You see that our phase changes at the top. We're asked to place a patient on a pressure support CPAP mode and adjust the pressure support level to maintain the effort and tidal volume in acceptable range. PEEP is now controlled by the clinician, anywhere between 5 to 10. And we ask the FiO2 is adjusted by the clinician to maintain the SpO2 between 88 and 97%. After this is done, we'll click OK. We're now in the weaning phase dashboard. This looks very similar to the acute phase dashboard, so there's a couple extra buttons. We now have the option to extubate without an SBT if there's an unplanned extubation, for instance, or we can repeat the acute phase ventilation. The main difference also is that now if we do take measurements, we'll have a few less options and our recommendations will be a little bit more simple. Now, by default, we're selected to be spontaneously breathing. Our respiratory effort we'll select and we'll enter in the pressure support, total respiratory rate, heart rate, PEEP, FiO2, SpO2, mean airway pressure, tidal volume, and end-tidal CO2. Here is our weaning phase recommendation. It'll ask us to either increase, decrease, or keep our pressure support level the same. And once again, we can either accept or decline the recommendation. If you do decline, we ask that you specify the reason. Now that we're back at the dashboard, we can continue to use the app by interacting with any of these action buttons. Thank you for watching.